Chapter 4. We're going to do a little bit of A&P and medical terminology. Then I'm going to pass out this paper of the terms in the book because I only go over some of them in the slide. The intro is, this is a basic knowledge of anatomy, physiology, kinesiology, which we're going to have a whole 8 weeks on that, and pathology. All that is necessary to treat clients with therapeutic massage. So, last week I kind of explained, did I explain? I don't know. You have the Swedish massage, which is your very light pressure. We're not focusing on anything. Most people don't really get that often. That's more of like new to the massage world, or you're at a spa and you're just there to relax. Once we get into anything with pain relief, it is automatically considered therapeutic. Therapeutic, the word therapy is in there, so just think of massage therapy. Most massages are a therapeutic massage. Anatomy. The term anatomy means the study of the gross structure of the body and the interrelations of its parts. So that is the body, right? Physiology is the science and study of the vital processes, mechanisms, and functions of an organ or system. So anatomy is the body as a whole. Physiology is how it is functioning. So that's where you get the anatomy and physiology. So anatomy, maybe we're going to learn about the heart, how it's structured, and then in physiology, the physiology part, you're learning how it pumps blood. Does that make sense? Yes. Kinesiology, this is the study of muscular activity. It uses anatomy, physiology, and body mechanics. So kinesiology is learning the muscles and how they move the bones, basically. Pathology is the study of functional changes caused by disease. So that's why we're also next semester having pathology. It's all important so that we can figure out the best treatment plan for our clients. Do you need me to go back?
I can find it.
I hear it. Boop.
No, yeah, that was me.
I don't know why mine's not, I tried to pull it up on my iPad and it's
Yes.
not.
You probably have to download it and then
No,
open
like,
it.
It's not giving me anything. All I have is under assignments, it doesn't show anything, it just shows the past assignments.
Go under files.
Oh, I tried
Okay,
to
fine.
because I
Okay, maybe this is it. Oh, this
Files,
is
PowerPoints. It should work.
that is kind of
Okay.
It showed up on my computer, but it's still.
You guys are all so good doing notes. Wait until next semester. None of you are going to be doing notes. I'm so proud of you guys for being good little students. All right, the relationship of anatomy and physiology to massage and body work. Why are we talking about this? Massage therapy has a direct effect on tissues. What does that mean? That means if we touch someone, it'll kind of start enhancing your circulation. It can enhance your lymph circulation and blood, right? Direct effects would be also stretching muscle tissue or loosening adhesions and scar tissue. So, a direct effect is what's happening as soon as you touch that muscle. The opposite, or not the opposite, more in depth would be your indirect. So when you touch those muscles, now you have a chemical reaction because of touching those muscles directly. This is the part everyone has a hard time with. So, indirect would be you have increased circulation to the muscles and internal organs. So we're going deeper in the body with this. Your blood pressure is generally reduced during a massage. That's why sometimes if somebody has low blood pressure and it's not managed, they might start getting fainty on your table. The good thing is if they're already on the table, they're already laying down, so you're kosher, right? Another indirect effect would be the release of endorphins. This one's big. So massage doesn't just feel good, but your body knows that it feels good, and then it starts releasing endorphins like serotonin and dopamine. So now it's almost creating like that natural pain relief and that natural high. For those of you who have had a professional massage, anyone in this room right now, you know that massage drunk feeling you get when you get up off the table afterwards?
I fall asleep usually.
Oh, well, when you get off the table, you kind of feel like you're in a slight daze. I call it massage drunk. Those are because of the endorphins and you just being in that relaxed state. Amber just passes out. That's the serotonin dopamine response. All right. And then massage also has a reflex effect on the body. The reflex effect is kind of similar to the indirect effect, right? So it's happening within the body. It reduces your heart rate. It also can slower and deepen your breath. So when you're in that state, you are more relaxed and falling asleep, apparently. Having better knowledge of all of these effects on the body helps us identify areas of dysfunction a little bit better. Now, dysfunction will be things that aren't working right. Now we're going to learn about recognizing physiological changes that usually happen due to disease. So our body strives to reach homeostasis. I'm sure all of you have heard this word before. If not, well, now you do. Now you know. Now you have heard it. Homeostasis is the internal balance of the body. So when our homeostasis is disturbed in some way, a lot of times our body can experience disease. So imagine if you're like super stressed out and then your immune system is weakened because of that weakness. Maybe you are around somebody who might have a little cold. Then you're more prone to be sick because of that immune system being compromised. Disease is an abnormal or unhealthy state of all or part of the body, or its system or organs, wherein it is incapable of carrying its normal function. So disease is a dysfunction of something going on in the body. When we have some type of disease, and I could just be talking about the common cold here, or I could be talking about something really serious, right? We tend to look for signs and symptoms. So that's what the doctors are looking for. Symptom is subjective, and that means what we are feeling. So what we're feeling, we're going to tell the doctor. We go in, we're dizzy, we have pain, we have chills, and whatnot. We're telling them what we're feeling. The doctor is then checking for signs to see if these are true. So signs would be something objective, being checked out by someone else. This is indication of disease. This is abnormal pulse, fever, physical irregularities. It could be your blood work. They check your blood work, and then they find signs of, elevated protein or something like that. Right? So that would be the sign. Symptom is what we're feeling. Sign is what we find to be true. Stress. We know what stress is. Everybody has experienced this before. It is any psychological or physical situation or condition that causes tension or strain. When we have stress, the adrenal glands, also the fight or flight hormones, tend to release hormones to help either boost your physical and mental body, right? And that would be your adrenaline. So think of this poor little lion, the lion's not poor. It's it's the wildebeest, right? So this lion is going after its prey. The prey is like, oh shoot. They see the lion coming after them. Instantly, their adrenal glands are like, this is really bad. We need to start pumping out adrenaline and cortisol. We need the adrenaline to get us on the move, right? Think of when people have super strength, when they have adrenaline, they can like lift cars off of people, right? Just stupid crazy stuff. And then we have cortisol. So adrenaline and cortisol get pumped out. Cortisol promotes breakdown of proteins so that allows for glucose to happen. You need glucose in the body to get the muscles and everything working at prime. So fight or flight hormones, bad. All right, so when we are in fight or flight, our pituitary gland and our hypothalamus also start kicking in. And these two things in the body affect function of the most internal systems. So fight or flight, pumping out hormones. This is going to increase your muscle tone, raise your blood pressure. So you need that blood pressure to raise so that you're getting the blood and the oxygen to those muscles so that you can perform, right? And then you tend to breathe deeper because you also need to bring in the oxygen that you're using. Now, the bad thing about this is it's normal to have fight or flight when you're going through a stressful situation like this. Maybe you were in a car wreck and you're just really stressed out, right? But when we are constantly in a state of stress, cortisol levels are going to be pretty high. Well, cortisol is a big cause for inflammation. Inflammation then causes pain. So people who tend to be stressed out more, if you have noticed, tend to have more pain and issues and health issues. Here are some of the long-term causes stress can put on the body, and it can be devastating. So it inhibits the natural inflammatory response to injury. So you're also not healing as well. It decreases the ability to resist infection. You're more prone to getting disease or some sickness, right? It can also have the same effect on your organs as severe sleep loss. Not good. Sleep is vital to healing. It increases the chance of having gastric ulcers, so you're going to have stomach issues typically when you're stressed. It also can increase your blood pressure. That's why they're telling people that have high blood pressure that they need to find ways to calm down when they're getting worked up, right? It can clog arteries over time, and long-term stress can be terminal. I mean, you're just not going to keel over because you're stressed out, but it's going to be a process that slowly kind of breaks down that body. Pain. This is one of the body's primary sensations. Pain tells us something is wrong. Don't ignore it. There are two types of pain reactions. We have a physical reaction and a psychological reaction. A physical reaction of pain tells us the location, the intensity, the duration, and the affliction, what might be going on. Maybe you stub your pinky toe on piece of furniture. Oh gosh, I hate that. All right, so you're having that physical pain. You know what happens, or you can tell us exactly what hurts and how bad it hurts. All right, so massage actually soothes the sensation of the brain by lowering the pulse and relaxing the body to help it to recuperate. So we can help with physical pain. Psychological pain would be anxiety, fear, and it can turn to fatigue. This causes physical pain. So a lot of people who do have more mental illnesses or depression, they tend to be in pain more often as well. Massage can also help to relieve some anxiety and fear. It provides a reassuring touch. It's really good for people who don't tend to like touch, or somebody who maybe was abused in the past and they're learning safe touch again. I'm going to zoom up on this fun little diagram I have here for you. I got to make sure it fits in the window, for goodness sakes. All right, so top one, we're going to start with pain. When your body is in pain, something happens called muscle guarding. All right, your body is kind of I'm going to use whiplash as an example here. You're in a car wreck, your head kind of bounces back and forth, right? Your muscles in your neck are going to be tightening to prevent more injury. So that's what muscle guarding is, tightening of the muscles to prevent further injury. And sometimes when the muscles are tight for too long, they can become inflamed or they can start spasming. When this happens, either inflammation or some kind of spasm, there's restricted movement in that area of the body. So again, whiplash, think neck. Now that we've guarded and we have inflammation, maybe we can't move our head as much, right? So you're having limited range of motion. And that with time can cause weakness in the muscle and then loss of function. And oftentimes when people are having this chronic pain, they tend to start having psychological issues. So people who are in chronic pain can be angry, frustrated, depressed. So it kind of goes along with each other, physical and psychological pain. So we have different ways that the body tends to heal. First of all, we have infection. So our body gets infected by something. This could be bacterial, viral, fungal, parasitic. We can have a local infection, so that's a little tiny cut. So, you're chopping up onions or something and you accidentally cut your hand, right? When it's healing, it gets red, itchy, all that stuff, right? So that would be your local infection. Systemic would be a spread throughout the body. So we'll think COVID, right? The SARS virus. Anything that runs through the body and creates some kind of sickness. Massage, this is highlighted because it's very important. Massage should not be applied in the case of a systemic infection. So if somebody is sick, and I'm not talking about they were sick last week and they're still kind of stuffy or sniffling or getting over a cough. I'm talking about in the main part of the sickness. We should not massage them. It puts too much strain on the body. The body is already trying to heal, and they could feel a lot worse before they get better. So do not work on people who are sick. Inflammation happens as a protective response to injury. So inflammation will cause swelling. It causes redness, heat, and pain. The reason why we need this is for healing. So when something is inflamed, at least for a very temporary time, that's good because we're sending little leukocytes and phagocytes to the area to chomp up all the bad, yucky stuff that's not needed anymore, or maybe tissue that is dying and whatnot. So we need that to go in and digest and kill the invaders. Fever. As much as we hate fever, it's super important to healing. So when your body raises in temperature internally, it creates an atmosphere where microorganisms can no longer survive. So when they're like, oh, the fever broke, that's good because then you start feeling a little bit better. A fever tends to be 102 or above, like a true, real fever. Now, some of you might start, for me, my natural temperature is 97.7. That's what it usually is all the time when I'm feeling great. If it's 99, I feel dead, like I'm dying. All right, so everybody's body reacts differently to an elevated temperature. All right, but if somebody has a fever, contraindication means don't do it. All right, so fevers are a contraindication for massage. That is one of the number one contraindications for massage is fever. All right, got a fever, reschedule. If you have a fever, stay home also, reschedule.
Do you normally have a lot of people that come in sick and you have to send them home, or do they cancel on their own?
Most of them are smart enough to cancel. So I don't think I've ever turned somebody down because they were too sick to be there. I did turn somebody down because they were intoxicated, like severely. We'll go over that. That was a funny story. Tissue repair. So once the body is healing, sometimes it creates scar tissue. All right, scar tissue is formed by connective tissue cells or also fibroblasts. So sometimes excess scar tissue can actually affect your range of motion and your mobility. So yes, scar tissue is needed, but sometimes it's too much. And maybe the injury was too much. Let's learn a little bit about scar tissue. Do you guys like my little slash marks on the side? I do. So if you have a surface level scar or injury like skin and surface tissues, those tend to heal very quickly and usually don't leave like a noticeable scar. Sometimes it does, right? Depending on how deep that injury was. So skin heals quick. Bones and ligaments, they tend to heal a little slower and might require mobilization, aka a cast or some kind of boot or something like that. And then we have muscles and tendons. When they repair, there's usually some kind of noticeable scarring, and there could be weakness or some kind of permanent dysfunction in that muscle. Has anyone ever tore a muscle or a tendon? Oh, man. What did you tear?
I can't remember exactly what it's called, but it was in my leg.
Front of leg?
It was in my thigh.
In your thigh? Front of thigh?
Yeah.
Okay, so probably some part of her quad. Whew! I just worked on somebody who had part of his quad completely just like rupture. And then he also had a growth. So two surgeons were going at his leg at once doing different things. Super cool. Not for him, but for me to learn about it. All right, then we have nerves. Nerves are the slowest part of the body to heal. Sometimes they do not heal at all. Sometimes nerve damage is so severe that there is complete loss of function in that nerve. So that would be like if somebody has an accident and then all of a sudden they can no longer use their lower body, something like that. Or sometimes you get maybe a surgery. Say someone gets a knee surgery and maybe your feet are numb for a little bit. Well, after time, sometimes that'll come back and then everything's functioning again. Or maybe you forever have like a spot on your leg that's always numb. It's just, nerves are weird. They can take years to fully heal. Does this make sense, guys? Cool, yeah. Surface, good. Nerves, no good. Wellness model. Wellness is a concept in which people take personal responsibility for their physical, emotional, mental, and spiritual state of health. I have this class discussion part. We'll see if you guys partake. How can massage therapy be part of a person's wellness model? Does anybody have any answers for me here? You guys, the newbies. So, physically, say somebody is in pain. You think massage can help? Yes! And we've already learned emotionally, say somebody has a lot of stress and anxiety. Massage can also help. For people like this, I think it's best for most people to get massage like every 4 to 6 weeks. This is usually what I tell people. Now, if somebody's not stressed out and they don't have a lot of pain or anything like that, I tell them at least once a season. So coming in winter, spring, summer, fall. So at least you get that person 4 times a year, right? So mental and emotional health kind of go together. Now, sometimes it could be like a spiritual awakening for some people, right? Also, some people might start crying on your table because a lot of times the body can hold stress and pain in a certain area of the body, when you release that physical muscle, they might have an emotional release. So be prepared for that.
Does that happen very often?
No, usually I just have people crying because they're sad about something. Like one girl's like, I'm sorry I'm crying, I just put my dog down. I'm like, why are you here?
No.
So she's like, because I still needed this. Okay. I'm like, that is really sad. But I've not released the muscle and had somebody start crying. But it can happen. Be prepared. I don't know how you would react to that.
Pat their back.
Pat their back. Give them a hug. So if that were to happen, because I have not experienced it, I would assume the best thing is to do is give them a moment. Maybe take your hands off of them and ask them if they want to continue the massage, if you need to step out of the room, if you want to keep going. Like, let them answer what they want for their emotional well-being, all right? Medical terminology. Let's dive into this just a wee bit. So medical terminology uses little parts of words to create words that we can kind of break apart and then understand what they mean. What I mean by that is typically there is a root, or they call that also stem, right? A prefix and a suffix. Root or stem, think of that as the beginning, the thing binding them together, right? Often two or more stems are combined with an O or an I to combine the two words. In my example, I have the word cardiovascular. The root or the stem is the one combining the front and the last word. All right. A prefix is added in the front of the root to further the meaning. Prefix, think of pre, before. All right. Example would be biology, the study of life. All right. Bio means life, and ology means study of. Then we have the suffix, or the suffix. This is at the end. All right. This usually denotes a diagnosis, a symptom, or a surgical procedure. So in my example here, I have colonoscopy. Why not? So this is colon. The O is in the middle to divide the words. And scopy means a scope. So this is looking into the colon with a scope, professionally and medically. So prefix, suffix, and then we got the stem in the middle. We're going to go over a few common terminology terms that you're going to see most often for massage and massage-related terms. So, what do I have here? So I have common roots and common prefixes. I should have put them backwards. Let's look at the second column first, right? And that's not a root. We're looking at the O's. Anyhow, so let's look at the one to the right, the common prefix. So contra. When I say contraindicated, contra means against or countering. So that means I am against you massaging somebody who has a fever. Dors. Think of a dorsal fin. A dorsal fin is on the back. So if I'm talking about the dorsal side of something, I'm talking about the back of it. Then we have hyper and hypo. Hyper means above or extreme. Hypo is the opposite of that, under and below. So somebody who has hyperthyroidism tends to have too much of the thyroid hormones, and hypo, too little. Then we have epi. This is upon, over, or in addition to. An example I have here is epidermis. So you have your dermis layer of your skin. Epi is over it. All right? Your epidermis is just your regular skin. Infra means beneath. Medi means middle, midline, and quad means 4, and supra means over, above, like you're superior to somebody. So I'm going to go back to the infra and supra. We're going to learn about rotator cuff muscles next semester, and we're directly using those words. So make sure you know those. That supra means superior, above, and infra means like beneath or inferior. All right, to the left, we're going to look at some of the common roots with some of these words. Arth or arthro would mean your joints. I'm going to see if the next one has anything. It doesn't. I need to add itis on here. Itis means inflammation. Arthritis means inflammation of the joint. So you see how just learning each term can help you decide what we're looking at and what we're talking about. Brachy is always going to mean your upper arm. Cardi is going to mean your heart. Gastro will be stomach. Hist will be tissues, like a histamine response. The word my or myo is usually referring to muscle. And os or osteoarthritis, right, would be bone. And therm, like a thermal, would be heat. So here's common ones I want you guys to learn. I'm also going to pass out this thing, and we're going to do some bingo. All right.